Why do we want to become dementia friendly? So just imagine this scenario. You see somebody wandering, lost, confused, agitated, unable to get home. How would you respond to the person? What if it were your mom, your dad, one of your relatives, somebody you knew? How would you want others to respond to them? And that's kind of the basis behind our dementia-friendly Quincy program, is to make sure that people are aware of the problem and know how to respond to the problem. The person that's wandering could be perfectly aware of your reaction, your first reaction, and we always say that first interaction with someone with dementia really guides how the whole interaction goes. They know, the dementia patient might know about their condition. They have periods when they remember things and periods when they don't remember things, depending on what type of dementia they have. They might know they're lost. Picture if it were you. You know you're lost and you can't get home, and how frightening would that be? So the person responding to you would really make a big difference. They're usually stressed, frustrated, and sometimes angry because of the situation. So an uninformed bystander really would miss the opportunity to reach out to that person and assist them with some understanding, leaving them frightened longer, out of sorts longer, more frustrated, more angry, and it just compounds the situation. So as responsible, caring members of our community, we have to try to better understand dementia, because it's going to continue and the numbers are going to get larger, and recognize the signs so that we can respond to these people, we can communicate with them, we can engage them, and we can support them. And also included in this is the caregiver, because the caregiver is very important when we talk about being social, staying social, and enjoying the community. Helping those that are around this person, whether they're the caregiver or just a family member, be able to live through the whole dementia experience. What is dementia? Symptoms associated with a decline in memory or other thinking skills severe enough to reduce that person's ability to live alone. When we talk about numbers, the scary thing is 7 out of 10 of these people live alone. They shouldn't be living alone, so that's the scary part. Think of dementia like a symptom of a disease. So I say equate dementia to like a fever. You get a fever, it's usually a symptom of something else, say the flu or an infection. Well, dementia is a symptom of another type of disease. It's usually most commonly caused by Alzheimer's, but you'll see that there's more than 50 different diseases that can actually have dementia as a symptom, and people don't realize that. You say dementia and Alzheimer's, and people think it's all the same thing. But Alzheimer's is the #1 cause of dementia, and that's why we have that comparison. Dementia can differ greatly from person to person. Really depends on the person and the disease that's causing the dementia. One person can experience really quick, short-term memory loss. Another might be affected by mood or behavior changes. Another might have hallucinations or loss of communication. Some might have all of those, depending on the condition or conditions that cause it. The exact symptoms that the person experiences really depends on the areas of the brain that are really being involved in that, in the dementia and the changes in dementia. We know that there's no cure for most forms of dementia. We know also that there's some medications out now that really do a good job in delaying some of the symptoms and treating some of the symptoms. There are a lot of non-medical and social interaction treatment modalities now.